Assalamu alaikum everyone. Welcome to Aman's Healing Code, where we simplify medical topics for students and professionals. Let's get started. In today's video, we'll explore the scapula bone. The scapula is a large, flattened and triangular bone located on the upper part of the posterior lateral aspect of the thorax against 2nd to 7th ribs. The scapula is highly mobile and consists of 4 parts, a body and 3 processes: spinous, acromion and coracoid process. The body is triangular, thin and transparent. It presents the following features: 2 surfaces, costal and dorsal, 3 borders, superior border, medial border and lateral border. The dorsal surface presents a shelf-like projection on its upper part called spinous process. The lateral angle is truncated to form an articular surface, the glenoid cavity. The lateral angle is thickened and called head of the scapula, which is connected to the plate-like body by an inconspicuous neck. There are 3 processes, that is spinous process, acromion process and coracoid process. The spinous process is a shelf-like bony projection on the lateral aspect of the body. Acromion process projects forwards almost at right angle from the lateral end of the spine. The coracoid process is like a bird's beak. It arises from the upper border of the head and bends sharply to project superior anteriorly. The site of the scapula can be determined by holding the scapula in such a way that the glenoid cavity faces laterally and forwards and slightly upwards. The coracoid process is directed forwards. The shelf-like spinous process is directed posteriorly. Now let's have a look at the features of scapula. The costal surface or subscapular fossa is concave and is directed medially and forwards. It is marked by 3 longitudinal ridges. This part of bone is almost rod-like. It acts as a lever for the action of the serratus anterior in overhead abduction of the arm. The dorsal surface gives attachment to the spine of the scapula, which divides the surface into smaller supraspinous fossa and larger infraspinous fossa. The 2 fossae are connected by the spinoglenoid notch. The superior border is shortest near the root of the coracoid process. It presents the suprascapular notch. The lateral border is thickest. At the upper end, it presents the infraglenoid tubercle. The medial border is thin. It extends from the superior angle to the inferior angle. The superior angle is covered by the trapezius. The inferior angle is covered by the latissimus dorsi. It moves forward around the chest when the arm is abducted. The lateral or glenoid angle is broad and bears the glenoid cavity of fossa, which is directed forwards and laterally and slightly upwards. A supraglenoid tubercle is present above the glenoid cavity. The spine or spinous process is triangular plate of bone with 3 borders and 2 surfaces. It divides the dorsal surface of the scapula into supraspinous and infraspinous fossa. Its posterior border is called as the crest of the spine. The crest has upper and lower lip. Upper lip and lower lip. Now let's have a look at the attachments. First we'll start from costal surface. The subscapularis muscle arises from the medial 2/3 of the costal surface, except near the neck, where the subscapula bursa intervenes between the neck and the subscapular tendon. The serratus anterior muscle is inserted on this surface along the medial border and inferior angle. The dorsal surface is convex and presents a shelf-like projection called spinous process. The supraspinatus muscle arises from the medial 2/3 of the supraspinous fossa. The infraspinatus muscle arises from the medial 2/3 of the infraspinous fossa. The teres minor muscle arises from the upper 2/3 of the dorsal surface of the lateral border. The teres major muscle arises from the lower 1/3 of lateral border and inferior angle of scapula. The latissimus dorsi muscle also arises from the dorsal surface of the inferior angle by a small slip. The suprascapular notch is present on this border, the superior border, near the root of the coracoid process. The suprascapular notch is converted into suprascapular foramen by superior transverse ligament. The suprascapular artery passes above the ligament and suprascapular nerve passes below the ligament. There is a small mnemonic: air force flies above the navi. That is, A, artery is above, and N, nerve is below the ligament. The inferior belly of omohyoid arises from the superior border near the suprascapular notch. The lateral border is thickest border. The infraglenoid tubercle is present at its upper end. Just below the glenoid cavity, and long head of triceps muscle arises from the infraglenoid tubercle. The lateral border of scapula is thick because it acts as a fulcrum during rotation of the scapula. The medial border. The levator scapulae muscle is inserted on the dorsal aspect of the medial border from the superior angle to the root of the spine. This area. From the superior angle to the root of the spine. Then we have the rhomboides minor muscle is inserted on the dorsal aspect of the medial border opposite the root of the spine. Here. The rhomboides major muscle is inserted on the dorsal aspect of the medial border from the root of the spine to the inferior angle. The long head of the biceps brachii arises from the supraglenoid tubercle. The posterior border of the spine, also called crest of spine. Trapezius is inserted on the upper lip of the crest of the spine, and deltoid takes origin from the lower lip. The coracoid process gives attachment to three muscles: short head of biceps brachii, coracobrachialis, and pectoralis minor. Short head of biceps brachii, coracobrachialis, and pectoralis minor muscle. Let's have a quick recap. So the scapula has two surfaces: costal surface and dorsal surface. Three borders: superior border, medial border, and lateral border. Three angles: superior angle, inferior angle, and lateral angle. Three processes: spinous process, acromion process, coracoid process. The costal surface gives origin to 3 longitudinal ridges. So here there are 2 muscles, subscapularis muscle and serratus anterior muscle along the medial border and inferior angle. The spinous process divides the scapula into 2 fossa, supraspinous fossa and infraspinous fossa. The supraspinous fossa gives origin to the muscle supraspinatus muscle and infraspinatus muscle along the inferior fossa, infraspinous fossa. Then we have the levator scapula muscle along the medial border here, rhomboidus minor muscle over here and rhomboidus major muscle. Along the lateral border we have teres minor, teres major and latissimus dorsi muscle. Infraglenoid tubercle gives origin to the long head of the triceps and supraglenoid gives origin to the long head of the biceps brachii. The posterior surface of spine trapezius is inserted to the upper lip of the crest of the spine, while posterior fibers of deltoid takes origin from the lower lip. So we have 2 muscles, trapezius and deltoid, from the upper lip and lower lip. And the coracoid process gives attachment to 3 muscles, short head of biceps brachii, coracobrachialis muscle and pectoralis minor muscle. Let's revisit the scapular bone attachments, but this time with another structure for improved understanding. So we have the levator scapulae muscle, which is inserted from the superior angle to the root of the spine. Then we have rhomboidus minor muscle, which is inserted on the dorsal aspect of the medial border opposite the root of the spine. Rhomboidus minor. First levator scapula, then rhomboidus minor, then rhomboidus major. Rhomboidus major muscle is inserted from the root of the spine to the inferior angle. Root of the spine, rhomboidus major, root of the spine till inferior angle. So first we had levator scapula from the superior angle to the root of the spine, rhomboidus minor, opposite root of spine, rhomboidus major, from root of spine to the inferior angle. Then on the dorsal surface we have supraspinatus muscle arising from supraspinous fossa, infraspinatus muscle arising from infraspinous fossa, teres minor muscle arising from the upper 2/3 of the lateral border, teres major muscle arising from the lower 1/3 of the lateral border, and the latissimus dorsi arising from the inferior angle. The serratus anterior muscle is inserted along the medial border and inferior angle on the costal surface. And then we have the subscapularis muscle, which arises from the medial 2/3 of the costal surface. The coracoid process provides attachment to 3 muscles, short head of biceps brachii, coracobrachialis muscle and pectoralis minor. 3 muscles, short head of biceps brachii, coracobrachialis, pectoralis minor. The long head of biceps brachii arises from the supraglenoid tubercle, and the long head of triceps arises from the infraglenoid tubercle. Long head of biceps from the supraglenoid and long head of triceps from the infraglenoid, the 2 muscles. Now that we have covered the muscular attachment, let's move on to its clinical anatomy. First, we have the Sprengel's deformity of the scapula, that is congenital high scapula. The scapula develops in the neck region during intrauterine life and then migrates downward into its adult position. Failure of descent leads to Sprengel's deformity of the scapula. In this condition, the scapula is hypoplastic and situated in the neck region. It may be connected to the cervical part of the vertebral column by a fibrous cartilaginous or bony bar called omovertebral body. An attempt to bring down the scapula by a surgical procedure may cause injury to the brachial plexus. Then we have the winged scapula. Paralysis of the serratus anterior causes winging of the scapula. The medial border of the bone becomes unduly prominent and the arm cannot be abducted beyond 90 degrees. That concludes our discussion on the scapula, covering its anatomy, attachment and clinical anatomy. Now that you know the importance of the scapula, tell me, did you know it moves every time you raise your arm? Comment below. If you find this video helpful, don't forget to like, share and subscribe. See you in the next